going to review posterior hip precautions. There are 3 movements you want to avoid while you're maintaining your surgical precautions in your everyday life. Until your surgeon says otherwise, you're going to maintain these precautions. 3 of the precautions are no crossing your legs, no internally rotating that leg, that surgical leg. So no doing this motion, and then no crossing here, trying to reach your feet. And the last one is most important. Never get your knee above the level of your hip. So you always want to maintain 90 degrees. So if I were to drop something on the floor, I'm not allowed to pick it up. When I'm getting dressed, I'm not allowed to cross my leg to reach my feet. I'll have to use some adaptive equipment or family assistance. When getting in and out of bed, so the hip precautions are very important to maintain with that internal rotation. So as you get into bed, you want to keep a nice neutral leg position, and you want to scoop back. As you come in, you want to make sure that leg stays nice and neutral. When you come out of bed, you don't want to sit all the way up, because again, I'm surpassing my 90 degrees. So I need to maintain kind of back on my elbows, and I'm going to just walk my legs over and slide out. That way I maintained my knee below the level of my hip, maintaining my 90 degrees or less. When you go to sit or stand, if you're going to a lower surface, you want to make sure that you slide your leg forward. So again, my knee is now below the level of my hip. When I go to get up, have my walker for safety. You're going to push up from a stable surface, keeping that leg a little extended in front. Push up, slide it back. Make sure you have your balance before you try to take a step. And when you go to walk, his walker, your surgical leg goes first, and then the opposite. When you go to turn, I know sometimes it's not easy to turn to a certain direction, but if you have the option, it's good to go the opposite of your surgical leg. So if you're going to take a step to turn, you're going to turn your walker, surgical leg first, and then run. That way you're not internally rotating the leg.